Well, hello everyone. A warm welcome to all of you. Very, very happy to have you all here. Clearly, this topic we're discussing today has generated a lot of interest and demand. Thank you all for showing up on day 3 of the School World Forum. I'm really honored to have this amazing panel sitting next to me to talk today about innovative measurement approaches empowering girls and increasing impact for girls across health, education, livelihoods, and human rights outcomes. My name is Linda Weissert. I'm Global Director for Equity and Gender and Youth at the Children's Investment Fund Foundation. We're going to be discussing lots of topics today on the topic of equity, meaningful measurement, and impact. Things like how can philanthropy become more equity-focused in its practices? How can equity metrics define, drive, measure, and sustain impact for women and girls? Who gets to define, measure, and take action for equity? And also how data and measurement can help the inclusion of the most marginalized groups in accessing government support systems. A very exciting discussion. Before handing over to my esteemed colleague and CIF's Chief Impact Officer, Anna Hakobian, I do want to briefly introduce the panel. Excuse the paper, but I have some biographies to go through. And I actually start with Anna, start with you. Anna is CIF's Chief Impact Officer, as I said, and she oversees CIF's measurement, evidence, and learning agenda across all of the areas that CIF invests in, be it health, nutrition, education, and climate change. So things that she works on and oversees include generation and uptake of evidence for policy change, be it at national or global levels, impact assessments, use of technology for impact, and transparency and accountability work. And I'm also proud to say that she has been one of the key champions in my organization when it comes to equity, really driving this agenda at leadership level. I'm also pleased to introduce Anissa Verdelima, who is the Director of Evidence and Impact for MSI Reproductive Choices. Anissa has been with MSI for the last 10 years and supports MSI's country programs to use data, evidence, insightful analysis, and innovative research to drive programmatic change across diverse contexts. So she facilitates cross-learnings across MSI, but also between MSI and the broader sector. And her passions, as you have said, Anissa, lie at the intersection of equity, uncompromising quality, and cost-effectiveness. Next, we have Carol Sikimpi, the Senior Country Director for MSI Reproductive Choices, overseeing MSI's programs in Uganda, in Kenya, Ethiopia, Ghana, and Yemen. She's a public health specialist and has experience working with both local and international development agencies, really being a leader in the field of driving operational efficiency and managing stakeholder relationships. And Carol, you had said that for you, data and meaningful measurement are the compass that drive and guide your work and the strategy you're implementing to make sure that you're reaching the most in need. Welcome as well to you. We then move over to, I will start first with Catherine Boyce, who's CAMFED's Chief Impact Officer. Catherine leads collaboration, innovation, and development for strategic functions in the global CAMFED consortium in order to maximize CAMFED's impact. Catherine focuses on climate action, women's enterprise, and monitoring, evaluation, research, and learning. And her passion is really about understanding, communicating, and acting on evidence to most effectively deliver on CAMFED's agenda. I then move over, welcome Catherine, I then move over to Lydia Wilbard, CAMFED's Executive Director for Learning and Engagement. Lydia has an incredible story, completing her secondary education against great personal odds. Lydia ran several successful businesses to fund her high school and university education. As a founding member of the CAMFED Association in Tanzania in 2005, she became an active business mentor and leader within CAMFED's network of young educated women. And Lydia's role really at CAMFED is to forge strategic partnerships with communities and government ministries to support the most marginalized girls to go to school, to learn, and to thrive. Lydia's background is in public health. She has a master's from Johns Hopkins University. And Lydia, you always say that you're deeply committed to maximizing learning across all of CAMFED's work. Welcome to you. And last but not least, Asif Sheikh. Asif was born in India to an excluded community. He's founder of the Migrant Resilience Collaborative and Jan Sahas. In 2020, Asif launched MRC, the Migrants Resilience Collaborative, which is a grassroots-led effort to closely partner with governments, the private sector, nonprofits, to support vulnerable migrant families to become socioeconomically resilient. And in this role, he's supporting 5 million migrant households and accessing that support. He's been awarded numerous accolades, including the Harvard Kennedy School's Gleitzman International Award in 2022, and he was also named the Schwab Foundation Social Innovator of the Year in 2020. I wanted to take this time to really introduce this panel because this is a powerhouse of experts really on equity, and I wanted you to get to know them, and you will get to know them more now. But before we have a panel discussion, I would like to hand over to Anna Hakobian to provide some more welcome remarks. So over to you, Anna.
Lovely. Thank you so much, Linda. And again, we're so thrilled to be here with all of you and with this esteemed panel. I hope this is audible. Yes, so we're going to talk today about equity and equity in programming and equity in measurement. I will just very briefly introduce Children's Investment Fund Foundation. Many of you know it very well, and in fact, we're really so happy to be partnering with many of you on this panel. In fact, I think all of you on this panel. Yes, so CIF has just celebrated over kind of 20 years of our history. We are working in areas of child health, education, nutrition, as well as adolescent girls' family planning choices and girls' education. Alongside that, we're specializing in supporting climate change programming and interventions. And really, we have evidence has been in our DNA since the day that we've been founded, and we've really been kind of priding ourselves in supporting organizations that also have that very strong focus on evidence. And often in the field and in the sector where somehow we're hearing snippets where people try to say, well, since evidence is really important, cost effectiveness is really important, is that really compatible with equity and equitable ways of doing things? And I really hope we can challenge some of those notions today in these conversations, because I think not only is it compatible, it's an absolute must. We cannot reach our development goals unless we have equity at the heart of everything we do. We know the Sustainable Development Goals have universal access as a goal in a number of them. We know the human rights provide such a rich platform for us in terms of working as a basis. And we know that the development agenda will not move unless we put this at the heart. So some of the challenges we sometimes hear is that getting to the last mile is more expensive, and sometimes some organizations or communities or funders might feel, well, that sounds too specialized, that sounds too expensive, it's important, but maybe it is not for us. And so we would really welcome a conversation here. How do we mainstream that, and how do we challenge that notion? Because when we actually look at the facts and at the numbers, and we have a panel here who will be talking a lot of facts, I'm sure, today, and a lot of numbers, that argument is only valid if we're focused on outputs. But if we're talking about impact, that kind of argument doesn't hold and doesn't stand. For example, it might be, 20% more expensive to reach somebody in a more rural community setting, or somebody who is more marginalized. But oftentimes in the same settings, we find mortality rates are much higher. Access to services is much lower. In some cases, if mortality is twice as high, which we're seeing quite often, despite that slight increase in the cost of delivery, you're still going to be 40% more cost effective in terms of the impact, in terms of the life saved and mortality reduction. So really, as there's numbers of ways we can express this notion, but whenever we look and if we cut at it and we look at the cost and benefit analysis and not just cost, immediately it becomes so obvious that we should be looking with an equity lens in mind. And so I said, armed with some of that evidence and notions and the not only the moral prerequisite, which is so important, but also the socioeconomic benefits of having the equity lens, we really started the journey at SIF of how do we make this the norm and how do we actually build this into our programming. So it's not an afterthought that, oh, we should now think of equity, but how do we design programs from the outset with the equity lens in mind? And so we decided to be really, really practical and pragmatic, and we created, something called the Equity Toolkit that we have rolled out across the organization, and we're very pleased we've now published an external version, so we very much hope this would be a public good, accessible to all interested organizations. And we're really helping guide our design teams who are designing programs from the beginning to think about equity. And there's sort of 7 dimensions. I will not go through all of them, but just to give you a sense, they're really practical things. In your design and targeting, have you done your analysis in terms of the subnational breakdown and understanding of the burden? Have you built in disaggregated data collection so as you go you can understand, are you truly leaving no one behind? How does your budgeting look? Is it really skewed towards, global north? How are you financing your budget? And is there really equitable allocation going to the local organizations and the communities? Are there organizational development needs built into the budgeting analysis? And we're also looking at feedback loops. Have you built feedback loops from the community that you're serving so that we can have the voices? We have some really interesting innovations where we've empowered adolescent girls to rate the services of the providers, the facilities and clinics like a TripAdvisor, and then actually the clinics are incentivized and rewarded based on that. So really putting the power at the heart of the girls who are the clients in our minds and not the beneficiaries, of the services, and they should have a say in the quality of the services that they are getting. We're also looking at building feedback loops through our community health worker programs in terms of developing, ongoing feedback from the households and then course correcting the programs. So those are some of the dimensions that we look at, and we go through that in the design stage with our teams. We have what we call an equity sort of a guidance checklist that we really, in a deep kind of a thoughtful partnership, work with the teams, and we understand, and then we assess the program from the beginning. How strong is it? How equitable it is before we actually approve those programs, and that's alongside some other criteria that's really driving the decisions of our board when they look at those proposals, the equity lens. I will stop there for now, and I'm really looking forward to a really rich discussion with our esteemed panel.
Thank you so much, Anna, for this excellent summary of SIF's approach to embedding an equity lens across our grant making. Yes, we now move over to a panel discussion. We have about 2 rounds of questions, and then we want to turn over to you. We want to hear from you, any questions you have, any reflections you want to share with the audience. And then hopefully we'll have some time for networking as well at the end. And I see people standing here. If you would like to come and sort of stand at the back. I know it's not ideal, there's not enough chairs, but please feel free to move around. Welcome as well. If anyone would like to take the tiny chairs. We appreciate you being here. Excellent, thank you all. Great, so let me start off in introducing the work of your organization. Could you tell us about what meaningful measurement for equitable impact means to you? And I'll start with you, Anissa.
Thank you so much, Anna, and thank you so much, Linda. Yes. Oh, now we're going to turn it the other way.
Loud voice.
At least I'm not going to go deaf. Can I say it's the first time that I'm in a Let's Call conference, and I'm both humble because I get to share the stage with such incredible people who spend their daily life like having a lastful contribution on the ground. And then I feel very honored because I get the chance to share with all of you guys some of the work that MSI Reproductive Choices is doing in making sure that we have measurable impact and really can talk proudly about the equitable impact that we're currently having. Probably most of you don't know, but like MSI was literally born out of the determination to really make an equitable impact. In the 1970s, our founder, Tim Black, Dr. Tim Black, he was working in Papua New Guinea, and he had just saved the life of an infant, only to find out that the mother started crying. And he was trying to figure out, like, why, like, your child is going to be fine. And she just turned around and said, I just have another mouth now to feed. That's going to take a toll on my family and what I need to do. And that was a turning point for him. And that's what MSI was born. Like, we want to be able to deliver services so women, girls, and everyone has a choice to make where they want to have children. So it doesn't come with extra burden for their life. And it's this drive that makes us be currently probably the largest organization to deliver sexual reproductive health services in the countries where we operate. We are in 36 countries. We have 9,000 fantastic staff that works very hard to deliver services. And then last year, we had one of the highest performing year where 23 million women, girls, boys, people were served with high quality sexual reproductive services. Just to bring it in context, in the sub-Saharan African countries where we serve, 2 out of 5 women that are currently using contraception are getting that from an MSI or MSI supported service delivery. So, and then I just want to share a little bit about the scale. How did MSI reach this incredible scale? First, it comes by working in collaboration with the government. Government is our key partner for us. We work with more than 20 governments in being able to expand access to sexual reproductive health services. We've worked and supported more than 7,000 public sector facilities, trained nearly 40,000 providers to deliver those services. Secondly, is being able to do end-to-end service delivery component, targeting the enabling environment, the demand, the supply side. So the woman, the client, has access to a whole set of information and services to make her decision what she wants to be doing with her life. And thirdly, probably one of my favorite, a dedicated, and I'm looking at you, Carol, because you work at the country program, incredible amount and talented staff who works tirelessly every day and have an unwavering commitment to deliver passionate service delivery to the girls and women that really need them the most. And fourthly, which is again one thing that is close to my heart, using data to make this decision. So our impact can be really effective as well as can be something that we are accountable for. So that was how we can deliver scale. But one thing we've been very clear at MSI is not to be able to compromise on the equity, on who is that we are reaching. And this is where equitable measurement really comes to life for us. Let's say we're all here, let's be very open. There is very few organizations that don't have on their website or any brochure that they publish how we reach the last mile, the poorest of the poorest, etc. And MSI used to be one of those organizations. And frankly, I want to be very open. When we got to collect the data, we realized we're not really as equitable as we thought we were going to be. And that's the measurement became very important. We're making this big statement, but where was the data behind it? How can we stand and say we're really reaching the poorest of the poorest? And I'm going to focus on this key demographic, on the poorest and the poorest. And there is a reason why about that. I know it's one of the most marginalized communities, but it means even more when you're working in sexual reproductive health. We have sex, we fall pregnant, but for a woman to fall pregnant in north of Nigeria is a very different experience than a woman falling pregnant here in the UK. That woman has 100 times more chance of dying from pregnancy-related issue than me, and I just went through a very tough pregnancy. I just had a baby a few months ago. But not only that. So that woman had 50% of these women that are falling pregnant don't want to be pregnant at that point in time. And they want to do something to avoid that pregnancy. But they can't. They're not having access to contraception. And just looking in Nigeria for the data, women, the poorest of the poorest, only 3.8% of those women are using contraception. That is a fifth of the women that are in the top quintile. This is the disparity. But for these women, again, within Nigeria only, there is another 80% higher chance of dying from maternal mortality than a woman that is in the middle of Abuja or Lagos, for example. So when you bring this together, makes our mission even more important to be able to deliver the services to these women. So we wanted to be able to measure this and to say confidently that we're really reaching this. So how did we go about doing it? Poverty is a complex measure. It's not one indicator. And you can't ask somebody, are you poor or so? There are a lot of metrics out there, and then it is a complex set of questions that you need to be able to ask the clients to determine the poverty level that they are. And that's where client exit interview started at MSI. More than 12 years now, every year, we do an annual representation of our clients where we collect information about them. We interview them for 45 minutes to really understand and hear their voice and their needs and their experience with our services. And those opened the eyes. Once we started collecting this information, we realized, wait a second, we're really not as equitable as we thought we were going to be. And not every channel of delivering services is equally equitable. One thing was true, though, that outreach, mobile outreach, that is used to deliver service to the last mile is by far, and cannot be contested, as one of the most effective way of reaching the poorest of the poorest. And actually, just to line a few numbers here, outreach teams, outreach service delivery, reaches 3.5 times more people living in poverty than the private sector, and 1.5 times more than people being served by the public sector, just because of the mobile nature of delivering services to where the people are in some of the most marginalized community. So we started to ask 3 questions to ourselves. Who are we reaching? And once we found out we're reaching, we're seeing numbers, 25% in Nigeria, 45% in Tanzania. The next question was, is this good? How do I know that this is good, right? What should it be? And that's where the benchmark became so important. For any metrics to really be really meaningful and for you to really understand whether you're doing well or not, is being able to have a very clear benchmark. So for us, was looking at a proportion of women of reproductive age that are living in poverty or extreme poverty. We're using multidimensional poverty index at the moment. So then the numbers started making sense. So for example, in Senegal, 30% of the women of reproductive age are living in severe poverty. Our results were showing we're reaching 18%. So 18% of our clients were living in severe poverty. This is telling me we're not good. So we need to do something else to figure out how to improve on these results, especially if we really have a commitment to the women that we need to be serving. So that's where the next question came. How? What do we do to be able to reach those women, to really kill that benchmark it's always on our mind? And that's where the poverty mapping became very important. So we started using as much information as possible. So using information from demographic health survey, being able to overlay the data, so understanding where you have a big pockets of population that are living in severe poverty, have population information as well, so you know in terms of numbers how many women of reproductive age are really living in certain areas. And on top of that, overlaying where our teams were going. And we could tell. For example, in Senegal, the example that I just mentioned, there were 2 regions just underneath Gambia. Gambia is coming in between in Senegal, where our outreach teams were not going. And their idea was, there are not as many people there. And we know they're poor, but there are not as many people there. And guess what? They made an operational change to send 2 outreach teams there in those regions. And within 2 years, guess the impact that we're having. From 18% of our clients living in severe poverty, we increased by 2.5 times. So by 2020, 50% of the people that we're serving were living in severe poverty. And that is 20 percentage points above what the national benchmark is. That's a success story for me. That's where we know that we are doing our job. We're using the data. We can feel confident what we're doing, and we can get the validity that what we're doing is having results. But we didn't want to stop here. Client exit interview, they're a wonderful tool. We have 200,000 voices of the clients that have shared their experience with us, but they come once a year. You want to be able to have this kind of information on a regular basis because operations are agile. They need to be changed regularly, not once a year. So at MSI, we took this further. We started introducing and collecting this information routinely. And that, the amount of granularity of information that you got and the timeliness of this information is unparalleled, because now our teams, our operation teams, can see this information and make decisions for looking at finding this information and the impact at the site level, where the teams are going. Actually, an understanding, look, this now site will have relatively higher proportion of people living in poverty, but in the same time, I'm getting 100 to 150 women coming every day asking for the services. What is that do I need to do to make sure that the frequency of return is matching this demand? So country programs can make decisions on a regular basis and continue to making our program more effective. And this is where we have come so far in terms of the journey of the measurement. But one thing that has been very important for us, which you guys mentioned as well, is being able to have that client feedback, being able to go back to the people we are meant to be serving. Yes, we're getting information from the client exit interview, but we have started collecting client feedback routinely and in the electronic way. And now, for the first 4 months that we start rolling out this system, in 4 countries, only through outreach team, we had 18,000 women that couldn't wait to share their experience with us that we're reaching. And what is it we're finding out? Thank you so much for coming. I would have to work 1.5 hours to be able to get the services. Or the other thing is, thank you for giving me a break from pregnancy. Now I can concentrate on the children that I have and give them a chance to go to schools, etc. And this is what we hear. Data is an extension of our clients. And before I finish for today, I want to leave you with a few key points from MSI. If something gets measured, gets done. So if you are really committed to reaching something, make sure that you collect the data for that. Secondly, you have the right benchmark. You need to be able to compare apple to apple and make sense out of it. Thirdly, make sure that the client feedback is there, so you can hear the client voices all the time to make the right adaptive changes. And fourthly, have some flexibility in how you deliver the services and information you collect to be able to have some of the most heightened impact that you could think. So thank you so much about that.
Thank you so much, Anissa. What an inspiring summary of the work that MSI does. What a powerful reminder of how to use meaningful measurement to close the gap between equity rhetoric and practice. And also thank you for your actionable recommendations in the end. Let me turn over to Lydia and Catherine from Comfort. Again, what does meaningful measurement for equitable impact mean to you and the work you're doing at Comfort?
Thank you very much. I'll start. And let me also appreciate the opportunity to be part of this panel. And thank you for setting the tone high from MSI. Yeah, so an opportunity to introduce Comfort. So maybe just like your history, Comfort was established to break the myth of that it's culture for parents not wanting to take their children, especially girls, to school. So I think there is still that belief. People think that it's culture, it's cultural. Parents don't want to take their children to school. But so the observation was that it's not culture, there is something behind. And the main thing has proved it to be over and over poverty. So our vision is a world in which every child is educated. Please underline every child. Because when people hear we are campaigning for female education, they think we are only for girl child, and therefore we are not equitable. So the vision is for each and every child is educated, protected, respected, valued, and grows up to turn the tide of poverty. So underline the end part, the tide. So when you are born poor, unless external forces are applied, those who did physics, Yeah. Unless external forces are applied, you are not going to be able to move. So unless something is pulling you out of poverty, then you are able to move. So we are envisioning that world where every child is educated, protected, respected, valued, and grows up to turn the tide of poverty. And the entry point for us is actually built on equity. Who is still remaining behind, even as we speak? You know, we still have 95% of the girls from poor families completing secondary school globally. So with all the SGDs and the MDGs, whatever we had, we are still at that level. Poor people, girls, 95% are still not completing secondary school. So we are looking at, the vision is built on how we are reaching the poorest, so that we can bring up the number, right? Because they are still pulling us out. So our entry point is really to support them to go to school. Because if the system defines school as a basic need, as a basic thing, if you are left out, then you are not fitting in the system. So we provide financial support to break the financial barrier for the girls who are from poor families to go to school. We support them to thrive through school and lead eventually, so that they access a table where decisions are made. Yeah? And therefore they can change how the decisions are made. So that's the cycle we are envisioning. So we do financial support, but we also provide the required wraparound support for the girls to be able to complete the school. And so the meaning of measurement for us is really to magnify that vision and help us do more, faster, and better. Yeah, so if we can speed up, because 95%, I think we should be running. Yeah, so our meaning of measurement for us is really defined by the why we are even measuring. We are measuring so that we can be able to do more, better, and faster for the most marginalized girls to be able to, thrive and eventually lead. And now I'll turn to my colleague to talk about the how. I just dismantled the why. Thank you.
Thank you so much, Lydia. And for us, meaningful measurement, as Lydia has said, is measurement that translates to learning and action. And that really is driven, we believe, by the who, the what, and the how of the processes of measurement, analysis, and learning. And if we want to focus on education, on livelihoods and leadership for marginalised girls and young women, we believe it's non-negotiable that girls and young women have an integral part of that process, that they're engaged at every step of the way. And of course, girls and young women do not exist in a vacuum. They're part of families, they're part of communities, they're part of schools, and they're part of education and livelihood systems within their own countries. So we need to engage stakeholders for all of those groups as well. At CamFed, we have an amazing network of over 25,000 people who are volunteering their time and expertise to monitor and gather data about how our programs work. They're spread across 5 countries in Africa, 165 districts, and nearly 3,000 partner secondary schools. And that's just the people who are gathering data. Many, many more are involved in interpreting, understanding, and acting on our evidence base. And who are these people? They're young women, they're clients of our program, members of the CamFed Association. We have 279,000 members of the CamFed Association leading our work. They're teacher mentors, they're community leaders and partners who are gathering data. And the kind of data that they're gathering is, for example, if a marginalised girl has been selected onto CamFed's education bursary programme by the community stakeholders because it's recognised that she desperately needs that support to be able to go to school and thrive, they're finding out, is she actually in school? Is she able to attend? Has she received every single entitlement which is laid out to her so she knows what she's entitled to receive? The schools, the blouses, the socks, the sanitary items. Has she received them? And that is checked on an individual level. We also have members of the CamFed Association, young women educated with CamFed support, who are volunteering their time in school as learner guides, going into school every week, working with a class of children, and to Lydia's point, that's boys as well as girls, and helping them to develop their skills and to learn effectively. And if there are any child protection issues, if a girl is at risk of being pulled out of school to be married they will flag that issue, they'll report it, they'll also take immediate action and mobilise community action to bring that girl back to school. Post-school, the network that I mentioned, those 25,000 volunteers are gathering and reporting data surveys, are how are young women transitioning to livelihoods after school? Are they able to build businesses? Are they generating an income? Are they thriving? So we rely, for all of our work that is done through CAMFED and for all of our evidence base, on this vast network of community-based volunteers who are leading the work. We provide them with technology, phones and tablets. We provide them with training in child protection and data collection methodologies. And that data flows through to our online program database, where we have an individual record for every girl that is supported. But beyond the data collection itself, the second part is how does that lead to action and interpretation of the evidence and decisions based on that evidence base. So it informs community planning meetings, it informs meetings of the CAMFED Association, the young women who lead our programs, whether at district level, whether at national level, whether at regional level, and informs program reviews. For example, how effective are our business support programs, are our programs for community climate resilience, how effective are they being, and how can we strengthen and improve them? So we're on a journey at CAMFED. I don't think either of us want to say we've arrived. I think we're continually learning, adapting and innovating, but hopefully we've been able to convey how, for us, meaningful measurement for equitable impact means having your clients at the very centre of every stage of the measurement learning process. Thank you.
Thank you so much, Catherine and Lydia. Equity is really at the heart of the work that CAMFED does. You briefly outlined the what, the how, but then also the so what. It's to do things better, faster. What was the other one? More, better, faster, indeed. Well done. Yeah, thank you for that reminder, Lydia. Over to you, Asif. Would love to hear about the work that MRC is doing and how you're centering equity and meaningful measurement for better impact.
Yeah. First of all, thanks for this opportunity. And basically, MRC is a collaborative of multiple organizations. And my organization, Jan Sahas, is basically leading the whole collaborative. And first time, basically, we try to bring together different kind of stakeholders, like the not-for-profit organization, philanthropic institution, investors, and the industry. Because all these four stakeholders play a very important and crucial role to support the migrant community or informal sector workers. So globally, we have about 1 billion migrant workers. And out of these 1 billion people, 75% people migrating within their countries and 25% people migrating from one country to another country. And our program is very much focused on internal migrant population. So as far as India is concerned, we have about 200 million internal migrants, and that's about 50% of the overall informal sector worker. So it's a huge population. And about 17 to 18% India's population is a migrant worker. So that's a huge issue. Before pandemic, this issue was not very visible. No any government program. Government basically initiated a very large scale program about 30 years ago, but no any recent like the policy or investment. So in that context, after the pandemic in year 2020, we launched this program. And basically the whole idea is that in India, we have 7,000 benefits available for the poor. And benefits including food subsidy, scholarship, health insurance, and many other like the benefits that basically the government provided these benefits to the poor people, and billions of dollars allocated every year. But the problem is that migrant population is, they are not staying in one place, so they are migrating from one place to another place. And as far as India is concerned, we have a federal structure. So basically if they are migrating from one state to another state, so in the second state, they are not able to get these benefits. And that's a whole issue related to the portability. And not only in India, in many other Asian countries, the similar kind of situation, the portability is not exist in the government program. So people are not able to access the government benefits. So we basically started a pilot in 2018 and 19 in one small area. And now we are scaling this program across 100 districts in India, and we are working in 13 states. And we have about 140 resource centers where the workers can come and get all the required support. And the role of technology and data is very, very important and crucial in our program. And how? So basically, the role of technology starts from the first step of the program. So basically, during the pandemic, what we realize in India, and not only in India, but in most of the countries, no any real-time data or like the social registry exists for the migrant community. And basically during the pandemic in many developing countries, government immediately come up with some ideas that we wanted to support the migrant population because they are most vulnerable like the people. But who are the migrants? That kind of data not available. So that's a one big challenge. And through the technology and data, we try to solve that problem. So basically we are using the technology and creating a social registry. And as of now, we have a database of 25 million individuals in India. And we are scaling this number. So our goal is to reach about like 50 to 100 million migrant workers and their family members. So, so basically in that context, technology help us a lot. And basically when we create the social registry, the system is also generating a report and that report called eligibility check report. So we basically using the eligibility engine in our technology. So if we collected the data for particular family, so system is generating a report within a minute that this particular family is eligible for how many social security benefits. So in India, as I shared, 7,000 benefits are available. In Nepal, 140 benefits. In Bangladesh, 80 benefits are available. So in each and every country, different kind of like social protection systems are exist. So we are basically trying to capture the most relevant social security benefit for the migrant population. And basically after putting the data, system generating a report, and then we have a 1,500 field force at a ground level, and these people helping to the community to access these benefits. So that's a overall like the program. And why I'm saying the role of technology is very important, because without technology, it's very difficult for us to scale the program. So technology and data not only helping us to convince our donor to give more money to scale our program, but also scaling the program at a ground level. So that's the one thing. The second thing, we also track the pattern of the migration in India. So for example, in like the water crisis in Bangalore or air pollution in Delhi, so lots of people are losing the job. And basically because we are collecting the data, so the data give us some idea ki how many people now migrating back from these cities to another city. And basically the climate change is a very big like the lever to increase the migration, not only in India, but in most of the countries. So basically to track the impact of the climate change in the community, this data help us. So basically the fundraising, scale the program, tracking the pattern. So all these things we can easily cover through the data and the technology. And one another thing, most of the time people believe that if you are focusing more on technology, so technology help us a lot to scale, but not for soul or not for the depth of the program. And that's a very big challenge. So for example, when we initiated the whole conversation about the data and technology in our organization, so many older people or like the old school like the people, and they are also come up very solid like the argument कि when we scale the program, when we will use more technology, what about the feelings of the people? Because many times the same like the migrant worker fall into the bonded labor or trafficking or commercial sexual exploitation, or they face different kind of like the challenges. And basically the data help us a lot at one level to scale the program, measure the impact, track the patterns and all these things. But at the same time, we also running some other systems. So for example, we started a national toll-free helpline. And currently every month we receive 10,000 calls from our beneficiaries. And as you rightly shared, sometimes like they call for the complaint, your program is not doing very well. I'm enrolled in the program for last 2 months, but no any impact. I apply for 5 social security benefit. Your team members are not helping us properly, and many other issues. And as far as migrant population is concerned, 80% people come from the most excluded communities, like the untouchable community in India called Dalit or scheduled caste, the tribal community, indigenous community, other backward community. So basically the level of education is very low. Most of the people are not using the Android phone. So these kind of like the issues are there. So helpline help us a lot to collect the feedback about the program from the community. And basically the last thing I wanted to share, the whole like the data and the technology help us to redesign the program. Because sometime like you design a program this year, but next year situation is changed completely. Government initiates some new social security program, and in most of the developing countries now the governments expend more and more money for the social protection because the benefit in the elections. So the whole social security system is also linked with the election or like the democracy. So basically in that context, we need to change our strategy very frequently. And the data gave us some idea how we can basically change or revise our strategy. Yeah.
Thank you, Asif. Thank you. Powerful work that MRC is doing on using data and technology to improve targeting and scale of your intervention, also integration to government systems. Congratulations. We now have a second round of panel questions, but we do want to turn to you, so please bear with us for another 10 minutes. I want to unpack some of the details of your work a bit more, a few common themes emerging, but really specifically, around certain aspects of your work. So if we could keep the answers to 2 minutes max and then move over to Q&A. Carol, let me turn over to you. Building on what Anissa outlined, again, on this aspect of using equity data to drive better impact, are there any sort of additional examples you want to provide around the approach or successes and learnings for this audience?
Sure, thank you very much. So as Anissa highlighted, for us, data drives us. It's the compass that points us where we go and how we go there. And we know that demand for our services is high, but data helps us to identify and understand what the bottlenecks are, and therefore how to intervene. And these bottlenecks can be at systems level, they can be at community level, or they can actually be at service provider level. So take an example for Uganda. Uganda is one of those countries that has stubbornly high teenage pregnancy rate, about 24% from the latest data. And a high teenage pregnancy rate is a proxy indicator for failed equity at delivering services to young people. So we know that majority of these young people are in rural areas, in the rural poor populations, and we do know that the best way to reach them, therefore, is through the private sector, the public sector. So, but there are bottlenecks to getting to them through the public sector. Bottlenecks like stigma, shortage of commodities, lack of leadership and political support, biases from health workers, and long distances that they have to cover in order to get to the services. So using this information for us as MSI, we intervene both on the demand side and on the supply side of service delivery. On the supply side, we have understood that young people do not exist in a vacuum. They are part of communities, they are part of families, and the best way to get to them is to begin by engaging with stakeholders. So when we're entering a community, we start with stakeholder engagement. And data is one of the strongest tools that we use in engagement. So you bring the district leadership, religious leaders, and whoever else is interested into a room and show them the data and say, this is how big your problem is. And then you show them the neighbors as well. But the neighbors are doing this well. So if you did these 5 things, you could actually move from this point to this point. And we find that when we have that data-based engagement with community leaders, we get their buy-in, and then they begin to track us, saying, how far are we with matching to reach the next community? So once we have that, they themselves will lead us to the public health facilities that they would like us to support. So in Uganda, we're working with a network of 700 public health facilities. And our first intervention, of course, having engaged the leadership, is with clinical mentorship. Mm-hmm. It's amazing how much the absence of knowledge or fresh skill for service delivery is a barrier to service delivery. Many people think that in public sector, the data tends to show maybe an overload of short-term methods and certain other methods not happening. And they tend to blame it on the preference of women and girls. But usually the issue is we have learned the absence of skills. when we provide clinical mentorship, then the women and girls are exposed to the full range of choice. And we see the data really shifting from an overdependence on short-term method to a more fair mix of all methods, including permanent methods, depending on what the clients want. We also know that without commodities, it's difficult to deliver services. So we use data again to support districts and local governments with their order levels, with follow-up of order fulfillment, with overstocking and understocking and redistribution of supplies to ensure that commodities are available across board. So we have leadership buy-in, we have well-mentored, competent health providers, we have commodities, and then we go to the demand side and intervene as well. We have an army of community health workers, because for every health facility you have about 5 community health workers. If you have a network of 700 health facilities, multiply that by 5 and you have the army of community health workers. These people live with young people. They play with them, they walk with them, some of them are their peers, and we work through educating them and sensitizing them, and they do the job for us with the young people, and then the young people come to the health facility. Now, Anissa highlighted the issue of client feedback. We get feedback, and we're constantly working to improve the client experience so that when the young people come to the health facility, they get a good experience. When they get a good experience, they become your advocate, because young people listen to young people, and then they will refer the next client and the next client, and you have a snowballing effect. And as a result of these kind of interventions, over the last 5 years, we've seen a doubling in the number of young people receiving contraceptive services through the public sector. We also observed something interesting during the COVID pandemic. So Uganda was shut down for 2 years during COVID. And in our service delivery, we saw an almost 200% increase in young people showing up for contraceptive services during that lockdown. When the schools were reopened, the number went back down. And so now we understood that school is a problem. They're having sex, but when they're at school, access is difficult. So through our engagements with this public sector network now, we are finding ways of making it possible for in-school youth to receive services. And this could be by opening up on Saturday. It could be by partnering with government health workers to provide, through the school health program, to provide the information and appropriate referrals. And we find some health workers are so excited about this. They talk about, after their own mentorship, them being able to mentor others. And so you're moving from the initial static health facility where we started, they're training the next level, and perhaps they are reaching out. So you have that snowballing effect for the services we provide. And one of the things that excites us as MSI, because through this model, we don't intend to stay forever. Once we have achieved certain KPIs and we know that certain levels of competence have been established, we begin to withdraw gradually our support so that we can focus on the next needy group. But we have observed that even when we leave, this level of productivity, level of service delivery within these public health facilities continues. And that makes us really proud.
Thank you so much, Carol. Great, thank you. Moving on to colleagues at CAMFED, Catherine and Lydia, if you could speak to two complementary aspects of the work you're doing. So, and that's a question to you, Catherine. At CAMFED, who gets to drive definitions and data use and resulting action? Who is sort of at the center? And then Lydia, if you could speak a bit more to the work you're doing on data and evidence and collaboration with government, something that all of the panelists spoke about in their work too.
Thank you, and I'll just share a few examples of who gets to define and drive this work. First question: who defines marginalisation? What makes a girl marginalised? Since CAMFED was founded back in 1993, we've said communities need to define this because they understand what marginalisation means in their context, and they know. And we're talking about gender-balanced community development committees that include a diverse range of stakeholders, they know who are the girls in their community that either are unable to go to school or at severe risk of dropping out of school because of the barriers that Lydia mentioned. So that first one is definitions of marginalisation being locally determined. The second one I wanted to share is acting on our evidence base. So we have an initiative at CamFed called Planning for School Excellence, which is giving the data back to schools and communities to understand how is their school doing on key metrics such as completion and progression and dropouts compared within the district context. And what actions does that community, so that will include students themselves, teachers, parents, other community leaders, what action do they want to take in response? And that's led to local leadership, for example, to build a hostel for girls to reduce the distance to walking to school, which can be a time when girls are very vulnerable, and also another initiative in another school to actually put electricity in teacher housing, because that really aids teacher retention in rural schools. There are many schools across rural Africa where they don't have a single female teacher because it's so hard to keep teachers in those schools. So that's two examples. And the third example I just wanted to share is work that we've been doing recently in Zimbabwe and Tanzania to co-design with young women entrepreneurs our livelihoods, impact evaluation and cost effectiveness analysis, which is going to be a very large-scale multi-year study at CamFed. And the first place we started with this was some co-design workshops with young women in those two countries to understand, from your perspective, what actually goes into livelihood support? What are the kind of components of support that make a difference to you? And actually, what are the benefits? I think we can all expect, okay, if you're supported on a livelihoods program, perhaps you may be more likely to set up a business, or you might grow your business, increase your income, have a job. And those are all valid outcomes. But what about things like well-being, mental and physical health, protection from gender-based violence? These are all outcomes and impacts that young women identified from our livelihoods program. I remember standing in a pineapple farm in Chilinze district in Tanzania with young women in our program, and one young woman saying, having an income protects me from violent men. She was totally clear on that connection. And so we've designed our impact evaluation to include all those range of impacts that young women themselves identified. I'll pass it over to Lydia for the second question. Thank you.
Thank you very much, Catherine. So, first of all, I think having evidence and data is very important with the conversation with the government. And I think Catherine talks about bringing the data back. The back is the underlying word, because they are part and parcel of the people who collect the data. So the data we are bringing back is not the data that we have done and then we are giving it to them. So then they are curious looking at what we have collected, and now you package it for them to be able to use. And that goes from the local government, from the local schools, from the young women who we account to, but also to the government level. And the government for us is really from the structure, not necessarily above, but above is very important. So recently we have embarked into a really systematic co-designing and on how our youth-led mentorship program that we have seen working over time to be able to improve attendance for the girls and the boys who are from the marginal background. They also improve learning, and more importantly, they transition when they finish school. So for the past, I think, 10 years, we have tested the model and we have seen it working in terms of impact to the children to be able to complete, but also for the young people as they transition out of school to be able to do something meaningful and come back as volunteers to the school. So we are looking with the government to see, so how do we take this to scale? How can it be integrated and embedded within the education system as a whole so that it can reach each and every child? Isn't it our vision for each and every child to be able to get education protected? And so a mentorship program that we have tested for the past 10 years, we are coming with the government to say, how do we look at this together? How will it work when it is integrated in the government? But the key thing is co-creation here, is not bringing the evidence that we have so that the government can take and use. It's saying, okay, we are taking a step back to say, look at this. We look at this together, and how the government will have to define on where and how this can be integrated into the government system. So we develop a committee, we have an opportunity for them to go and witness in school, interview children, so we define the questions, they come and reiterate the question they want to more understand about the program, but also because they are government, they are at the end of the day, they have the mandate. They have the mandate and the responsibility to account for each and every child. So they are looking at us as a partner to be able to drive the conversation and use the evidence. For example, in one of the research, we realized that only 45% of the poor children can attend up to 85% of the school time. So if the government is aiming at learning, you must push the attendance, right? At least, increase the number, the percentage of children who attend at least 85% of the allocated time. So we are working to look at how this model of peer mentorship can help those who are not attending regularly so that they can at least show up. And if they are living in their communities, then the model of youth, they will be able to help them to track those who are not attending regularly to be able to come to school, and ultimately the initiative that the government is putting in place in school for the children to learn, then they are able to learn. So I think we are looking at how the government can integrate the youth-led mentorship program that will eventually unlock the potential in terms of completion, attendance, and ultimately learning, especially for the most marginalized children. Thank you.
Thank you so much, Catherine and Lydia. And finally, over to you, Asif. And briefly, before we turn to the audience, you talked about, again, data and technology to advance system-level change for vulnerable communities and parts of India. Is there anything else that you would like to share around that, maybe in terms of key challenges or learnings?
Yeah. So I just wanted to add one point. So as I shared, in India we have 200 million people, like the migrant workers, and our program is only serve about 10% population. And no any organization or philanthropy can reach to all the migrant population. So the role of industry and the government is very, very important. So basically we are using two approach. One is an individual level change, and the second approach is a system level change. And for the system level change work, data and technology, again, very useful. I can just share with you one example about one state called Chhattisgarh in India. So we basically deploy 3 of our team members in the labor department. They are working within the government system, and they are basically developing a feedback loop from community where we are working, from community to the government. And basically they documented various kind of like the challenges that community is facing to submit their application for the benefit. And basically we worked with the one state government for 1 year, and basically we suggested few changes in the policies, and the government did all these changes in the policy. So now in the second year, the increase of 350%, like the 350% increase in application. So that's a huge impact. And basically we only deploy 3 people, but the we use a lot the technology and the data. And same thing we try and test with the industry. So basically the construction industry is completely dependent on the migrant population. So again, we are using the data and the the technology with the industry, and now the industry is also paying the facilitation fees. So basically, the whole idea is how this model will be more sustainable, and we will not completely depend on the philanthropy. And the data and technology is helping us to go into that direction.
Thank you so much, Asif. Well, thank you to this wonderful panel again. Round of applause. I've been working on equity for the last several years, but I keep learning. I learn every day, and this panel has just, given me so much food for thought. We do want to, and I think do we have 5 minutes for questions? Yeah, at least 5 minutes, and there's lots of questions here. You had your hand up first, and then I'll go round. If you could keep it very brief, just the question, yeah.
First, congratulations, amazing. My question would be, I'm Ricardo Gorodich from Argentina. So you finished a little bit. If you include long-term assessment, because it's clear that the database and you get to the populations, then the process, so you collect data to help, and then the impact when you finish. And the question about long-term, once you are not there for the family, any way you assess, maybe the systems change would be the answer, but I was wondering if you include that.
if one of you could take this question, probably one answer would be, yeah, very briefly. We just do that, and then I hand over to the next person.
I can do a quick answer on that, which is to say every year we do a survey of members of our alumni, some of whom joined the network back in 1998. And that gives us, and we weight it, and that gives us data as to sort of long-term outcomes. We also have some long-term studies as well, I'm sure colleagues do as well. Thank you.
Yeah, thank you so much for your contributions on this panel. I'm Clau, I'm from Lafia, Nigeria. We work on sexual reproductive health in northern Nigeria as well, with those who live behind the system. And my question is about publicly sharing the data that you find, because collecting information is expensive, measuring is expensive, and I know there is a lot of conversation about sharing this with government, but also like how about other organizations publicly in the space so we can all learn where to best target our programs and how to design them.
Maybe what I'll do is I'll take a couple, and then one of you can decide to. You had one, and then I'll move over to you.
Hi, I'm Marek Prashevich from an organisation called Together for Girls. It's very data-driven, very outcome-focused, like all of you. I was on a different panel yesterday, and the discussion there was about less restrictions on funding and donors investing longer and not demanding so much in terms of data from organisations like us. So how do you think that should be squared, and to what extent do you think donors should be willing to trust us to mark our own homework?
I'll take one more, and then we go back to the panel.
Thank you. Firstly, outstanding panel, and incredible the work that everyone's doing and the scale of it, and the insights, the data, the metrics, how you're using it to drive change. I'm from the Marishi Invincibility Institute in South Africa, and we offer free university education and school education, predominantly for girls. So the first question is to CAMFED. I was fascinated to hear that you're now starting to also support boys as well. And we've seen also in South Africa, like organizations like ours that have been supporting girls for so long now. Now you're starting to see boys really being left behind. And so it's very interesting to know what you're doing and how do you have that proportion. So now we're doing 70% girls and young women and 30% boys. And yes, that's the first one. Second one is I'd be very interested in, are you doing any kind of tracking with what's called the Green Light movement, this poverty stoplight, to try and understand how poverty overall is lessening in the families where you are working, and just do you use some kind of indicator to measure for your beneficiaries how poverty is reducing for the whole household where they're coming from? Thank you.
Who wants to go? Okay, who wants to go on either of those three questions? And in the meantime, I'll make my way to the next person. Anissa.
I'll start very quickly with you in terms of like making the data available. At MSI, we're guilty, yes. We collect a lot of data, and there are reasons why all of this data is not available, and that is confidentiality. The type of services we deliver can be very personal, and there's always risk associated with it. However, there are a lot of other data that we can make available. Like, for example, our results from the client exit interview. And this is what we're currently working right now. We've put our protocol and the way that we run our client exit interview available on our website for everyone to be able to use it. And secondly, we'll be able to share some of this information much more widely. The other types of data we very much use is coming from the government, the health management information system. That's the wealth of information. That's where we learn ourselves in terms of the wider impact of across different regions in Nigeria, even down to the province and the type of facilities. So keep in touch, because we are sharing more and more. Of course, we have to be aware. Data on sexual reproductive health services are not the same as if you're doing a WASH program. There are a lot of sensitivity around those data. I think the second questions that coming from Marek in terms of how do you balance these things, a lot of demand for the data, but on the same time complaining there's too much data, etc. I think it's a very interesting question. The data really matters. I mean, I'm going to talk only from a side perspective. there are sometimes lots of requests, and we're like, oh, we need to collect this, we need to collect that. But where we are trying to make a decision is like we need to align as much as possible with the requests that are coming from the government. Government is collecting data, and like our approach should be to align as much as possible with what the government is asking as critical criteria to collect information. So we're not setting up a lot of parallel systems, but we're maximizing on those resources. But in the same time, there's so much value in this data. And if the organization has invested, for example, we've invested a lot on routine data collection. As I mentioned, all of this information are being captured at the point of service delivery. It is not coming with additional cost. The investment has been done. We are in place right now. We're just now digging and really squeezing this data to be able to share the learnings and bringing them back into the practice. So aligning with the government, but if you've set up the system and you can run collection of the data, utilization of the data as effectively, as efficiently, for us, from my perspective, this is a personal one, maybe not MSI, it's like you need to use this data if you want to stay at the top and you want to feel accountable and you can really measure and talk proudly about the impact that we're having. And in terms of the school, I'm going to pass it on to you.
Yeah, I can take the equity part of the boys, the girls, right? Yeah. So just to reiterate that the issue of equity should be the underline here. So who is the most needy, I think is the important thing. And who defines the need is also an important thing. So what we have seen over time is that the need for the boys might look different for the need for the girls. So when it comes, for example, access to secondary school, boys might have more access compared to the girls. So the point you'd want it to intervene is for the girls to access. But when they're in the school system, maybe the thriving might be challenging for both boys and girls. But what intervention will be needed for the girls to thrive in school might be different for the boys' needs in terms of them thriving in school. So for example, the peer mentorship program that is focused on life skills, well-being, to support the unlocking inner power of the children to be able to thrive and build the resilience they need to finish school is the need for both boys and girls. So that's why our peer mentorship program is really focused at the whole school, because for both boys and girls needed to unlock the power that they needed to be able to build the resilience needed. But so when sometimes I have heard of people saying we have invested so much in girls that we have left boys. But I tell them there is no deliberate interventions that has been put in place to bring boys down. So that has never been the intention. So I think the narrative is what is needed for the boys so that we can provide what is needed for the boys, rather than talking about you have invested too much in girls and therefore we are leaving the boys behind. One story that I had recently in the discussion was, I said, so what is the issue with boys? Where are they that we have left them behind? And someone said, now you see our boys are finishing school and riding boda boda, ending up being boda boda. Boda boda is motorcycle, right? Riders, and therefore, and where are the girls? Because if only we can get our girls from poor community to ride boda boda, that would be an achievement. Yeah, so I think the equity definition needed to be carefully crafted when it comes to who is most needy and what they need. So in our programming as an organization, you have seen over time, we have learned the different needs, and therefore the programming that we focus for girls are different from that would benefit the population of the school, for example, both boys and girls. Thank you.
Ashif, maybe briefly, and then I also wanted to there was a question on about funders, so I wanted to get Anna's take if possible as well.
Yeah, only 30 seconds.
Yes,
so
go.
I wanted to add 2 points. So if we are collecting data for the donor, I think that's not a very good idea, and donors should understand that if the organization expend lots of time, resources for the data collection for the donor, that's not sustainable. So actually in our program, as I shared, we are collecting the data to sustain our program, to change the system, and also to report back to the community. And basically, that data we also share with the donor. So we are not like collecting any particular data for the donor. And I think if we can build that kind of understanding between the implementation organization and the donors, that would be a really powerful idea. And the second thing about the sustainability of the program. So I think if we can focus more and more on system level change, that's that thing can sustain the program. Otherwise, like the NGOs or the not-for-profit can only play a role of facilitator, because all these problems like the health, education, livelihood or employment, these are the very big problem, and the philanthropy can contribute like 1 or 2%. But 98% resources will come from the government. So I think if we will change the system of the government or like make some changes in the government system, then the processes will be more sustainable.
Thank you. Anna.
Yes, thank you. Thanks so much, Linda. And I think we're probably coming close to closing remarks as
We
well.
are.
So we'll try and summarize as well. And thank you for the great question. So I think we really strongly believe that we should only measure what matters. And fewer is better when it comes to that. And we really, again, want to look at data not as something that we do afterwards. So we design a program and then we go collect data, because then it becomes a burden. But how do we design the programs using data? And we gave some prime examples, I think, today on this panel, because it really helps us challenge our assumptions. I think our panelists mentioned today, because we all work in international development, which at the heart of it has poverty alleviation, we assume that we are equitable and that we are inclusive, that DEI agendas, equity, inclusion, this is for the private sector and some others to worry, and of course they should. But actually, when you look at the data, it really challenges our assumptions. We did similar exercises, and you'll be surprised, even with some of our best partners, you'd think like 60-70% of what they're doing is servicing the top 20 quintiles, wealth quintiles in that particular country. So I think really using data to challenge our assumptions rather than just collect it tokenistically is what we think is going to be really valuable. So yeah, I think let's not assume because we're in this sector we've cracked equity and inclusion. Let's also not assume that being equitable means being costly, because when we look at cost and benefit, it just plays out very differently. And I think in terms of call to action, maybe in concluding remarks, I think a number of you would have been at the opening plenary yesterday. There was a lot of remarkable speakers, including the former Prime Minister of New Zealand. And she said something that really stuck with me. She said, never lower your expectations. Even in these difficult times, I know we're really kind of difficult times as a development community, but equitable development should not be an aspiration, it should be an expectation. So I really hope we can carry that with us and really use data as a friend and as a voice of the marginalized communities, because oftentimes that's how we will see how we're servicing them and then use it for action. So thank you so much, everybody, and Linda, and this amazing room as well.
Thank you, Anna. Thank you. We would have liked to have more time for questions. You're welcome to engage with the panelists afterwards. I do want to just briefly, building on Anna's point, Anna's call to action, if I can ask every one of you briefly, what's your one recommendation or call to action for the field and the sector in terms of meaningful measurement for equity? One sentence or one word.
Use the data for impact and the scale with system change.
Remember, organisations don't own the data, the clients do, and they need to have an active role in understanding, interpreting and acting on it.
Measurement is meaningful if only it is for action. Otherwise, it's a waste.
There's no such thing as hard-to-reach communities. Rather, there are communities for which our current systems don't work. So our job is to adapt the system to work for those communities or go beyond the system, as we do, for example, with mobile outreach.
And equity drives impact. It costs only $20 to reach a woman in one of the most marginalized communities and provide her protection from unintended pregnancy for over 5 years. $20. And this is going to the largest, furthest away community. Bringing back to Anna, it is cost effective. Like really, equity drives impact. It's not costly. It's effective. And that's what should be done.
Thank you so much. We'll be disseminating a recording of this event thanks to our wonderful tech support and hope to engage with you more on this topic. Thank you so much.